Well, it actually is absolutely a pleasure to be here. I've been here before, but never in the winter. And I know people say, why would you come in the summer? The Ideas Festival and other symposia, but it's gorgeous here, and it's a pleasure to be here. I want to pick up on a lot of the things that have already been talked about and broaden the scope out a little bit. So you had Willa and Becca talk to you in general about collective impact. You had Jeff do a terrific and amazing job of talking about how you really strung together a set of critical education goals to make sure young people are moving from cradle to career. I want to back up and give you a little bit of the reality of what, over the past 20 years, we've seen communities struggle with in this place of partnerships, coalitions, networks, initiatives, task forces, where we're all trying to do the complex job of making sure young people are ready for college work and life. Now, again, the challenge of saying we're going to tackle cradle to career, we're going to make sure young people are ready for college work and life, is that means a lot of issues for a lot of people. All right? You can name them. You've got them all here. All right. So let's say there's been a teen pregnancy spike in your community, and you say, we have to do something about that. We're going to reduce teen pregnancy. Well, you're going to come together, and as Becca and Willa said, because this is a complex problem, there's no single solution to it. So people are going to start to propose different things that could be done, just as you started to propose things that could be done. All right, so let's say what we're going to do. We're going to do life skills education. That's going to help young people make sure they really have the skills to reduce teen pregnancy. Then you say, how are we going to get that happening in our community? Well, just like you're doing now, some people come together. They form a task force or an initiative or a collaboration, right? This happens over and over and over again, very naturally in communities. An issue pops up, we care passionately about it, we come together and think about different strategies, we coordinate people to come together to say how we're going to get this done. Sometimes we bring together programs, but more often than not, it's a group like yours. We're bringing together folks who can find or amass the resources to make changes to get some of those things in the middle column happening. No one thinks it's a one-on-one relationship, one problem, one strategy, but the end day is what we end up with is fragmented leadership. And we have to acknowledge that as a starting point. If you're going to tackle a big goal like getting young people ready for college work and life, college and career readiness, there are going to be folks in your community who believe every one of those issues has some bearing on whether young people are ready, right? Whether they got pregnant, whether they're using drugs, whether they're obese, whether they have good civic skills or social skills, whether they've been volunteering. There are going to be people who are passionate about those pieces being a part of the equation. And as you go out to do your community conversations, you're going to have to listen, and you're going to have to find a way to keep them at the table, even as you narrow down your goals. So this isn't about all of those things have to be up on your screen, but it is if we narrow too soon. And Becca said, be careful about when you narrow. If we narrow too soon and we don't get the community voice and we don't allow the folks who are passionate about different things to figure out how their pieces fit together, you'll have a problem. What I'm going to do is show you real slides for real places. This is not from a huge place. This is from a county in upstate New York, where they decided, and they really gave this job to one poor young man who was told, it's your job to be the liaison to all of the collaborations and initiatives. And so he set out to find out where they were, and this is just in the children and youth area. This is not everything. This is just children and youth. These are not programs. These are task forces, work groups, initiatives, things that have been created where people are coming together to try to move the needle on something by changing conditions, services, policies, whatever. This is his best attempt to really organize them and group them so he would know how to spend his day moving back and forth between them. I mean, this is serious. And this was progress. Before this, we just had them in a list, and we knew they were there, and we assumed that because you had all these different things, change was happening. Change doesn't happen when we have this much fragmentation. And giving it to one poor intern to coordinate is not enough. He alone was not a backbone support. Here's a concrete example of what happens when we don't dig deep into what's going on. Again, two real stories. This is from a Midwest community. They had a Safe Streets Coalition. They worked with us, they went through a very clear process of deciding what the indicators were that they wanted to have for safe streets, and they picked 4: abandoned housing, crime rates, et cetera. They talked, did community conversations, they identified 14 different interventions that they thought were useful. Each neighborhood got to decide which ones were useful to them and which order to do them, but they identified things from cleaning up abandoned housing and making sure that there were street lights to making sure there were after-school programs and community policing. Each neighborhood implemented them. Someone asked a question about tipping points. Because we were helping them collect data on whether they actually were achieving the things that they set out, what we found was very clearly in every neighborhood, when 7 or 8 of those 14 interventions that they had decided on were completed, it didn't matter which 7 or 8, when they were completed, you started to see the numbers go down consistently across neighborhoods. Had they not been tracking, had they not had this process, had they not decided that there really were 14 things that needed to be done, not just 1, they would have given up when the numbers didn't change, because it took about 2 years for the numbers to start to change, and they would have moved on to a different thing. But what you see here is an example of why, and this is just for 2 of those coalitions, why doing what we call context mapping to be able to build your capacity to achieve collective impact is so important. If you look at the list, here's the Safe Streets Coalition. Those are the folks that were involved in the Safe Streets Coalition. All right, they also had a teen pregnancy coalition. Those are the folks that were involved in the teen pregnancy coalition. 2 very different topics, you would think, but you can see the overlap. And sometimes that overlap was not just an organization, it was down to a person who would go to one meeting on Tuesday and the other meeting on Thursday. You say, all right, fine, there are only so many different people you would bring together at the table. Maybe you can't do anything about that. Let's look at what they actually decided to work on. Again, 2 different topics, safe streets, teen pregnancy. Once they started having those conversations about what it would take to address the problem, there's also overlap in the interventions they decided to do. Had those coalitions never come together, they would be using limited resources to tackle some of the same problems in different neighborhoods, in different ways, with different groups. You can't get to collective impact without somebody coming in and digging inside of all of these little coalitions. You can do the same for programs and asking, what are you trying to do, where, with whom, how, and can we actually map this and do it together? Those mutually reinforcing activities can be chatted about around the table, but there are actually ways to generate data so that we can actually pull up what the common things are. And the challenge and the beauty of this, we've done it in groups like this over and over again, the challenge is when we have limited resources to tackle a complex problem, we often pick the most obvious solution. The root causes often don't get addressed because you think, well, I just have a little bit of money. I can't tackle housing or transportation or those kind of issues. I'm just going to have to do something small. Once they got in a room and they realized the overlap in their interventions, the things that they were not working on because they thought they were too big, they now had the capacity to work on together. So there is a way to do collective impact, but it really does mean that we have to do business differently as leaders. We've taken to drawing 3 years, and you've been hearing this theory. We all want to change outcomes for children and youth. The first thing is we have to agree on them. We have to go through that process of acknowledging that if we're talking about a whole child, there are lots of pieces. We're talking about development, that's birth to young adulthood. That means there are a lot of outcomes, and it takes time to figure out how you want to link and order them together so that everybody feels the thing that they care about is being addressed and that you're actually putting out data that the community can see. Those supports that have to happen, family, school, community, to create the conditions to get to the outcomes also have to be mapped and measured. But the most important thing, as we found, and I've been doing this work a long time, I started in the big gear and got people thinking about outcomes, then moved to the middle gear and got people recognizing where the resources were in their communities, but then finally, you realize, as we've been talking today, you're gonna hit a ceiling if we don't get the leaders who manage policies, who manage resources, who make decisions about what the priorities are, and who have the capacity to motivate and incentivize change. If we don't get those folks actually to do business differently, to be accountable to themselves and the community as leaders, this is not pushing accountability down, it's taking on the role of being accountable community leaders. If we can't change the way we do business, the rest of those wheels won't move. And if we don't find concrete ways to be accountable for our progress, the rest of those wheels won't move. So a part of this is about not just having data about child and youth outcomes, but data across all 3 gears. So 3 years ago, we tried an experiment. We've been working with communities for a long time. We've seen enough evidence of what's happening. And so we started to say, there are concrete things that those leaders need to do together. This is a list that looks like a lot of the lists you've already seen. We created measures for these and anchors. We went into communities and they did interviews and surveys of the folks that they thought were critical, like you, to have around the table, and asked them, do you think these things are critically important to do if you're going to work together for children and youth in your community? We didn't name a particular problem. Just, do you think these capacities are important, and do you think you're doing them well? The answer was, these capacities are critically important, even if they're a little bit wonky. Shared data, all those sorts of things. Are we doing them well? Absolutely not. As soon as you actually gave the community leaders data that said they were essentially operating at half horsepower, they were able to stop. They were able to pause, not name another program, not name another initiative, but basically say, if we don't clean up and build our capacity to do these things, we won't be able to have enough horsepower to move the needle. So the message here is, I can give you examples of communities that have gotten to the other side and have moved the needle on the outcome they cared about. But what we've been doing is helping communities really assess their capacity to do needle-moving behavior once they've gotten the collective impact bug, and then come back and figure out how concretely to work on those things. We do that. Someone asked a question about training. This is absolutely about training. And it's not just training in collaboration, it's training in what we would call community change management. Businesses understand that if you're trying to get a complex organization, a complex enterprise to change, you actually have to go through some processes, and you have to go through them well. Nobody goes through them in lockstep order, but we really can build capacity. How do you build your partnership? How do you take shape? How do you actually go out and take aim, find out what the goals are, what's going on, pull the data together? How do you really go out and then start to take stock to understand what the solutions could be? I can have the exact same number in 2 communities, and the community can tell us that there are very different ways that they think that problem plays out, so they're very different solutions. How do you then develop the action plan that links back to the local data, that links to the individual partners, get all that together, and then finally, how do you track progress across all 3 of those gears, not just tracking progress in the child and youth outcome gear? In September, we've been doing this in small ways, but we partnered with United Way worldwide to offer the first of what will be probably 3 times a year training, a 3-day institute to just understand that there is a science behind doing this. And you do actually need to be able to do it. So take those things across the top very quickly. We talked a lot about, you've created a Cradle to Career initiative. It is one of many kinds of initiatives in your community. You've got initiatives that are focused at the neighborhood level or inside of your small communities that are really working on things peculiar to that community or that neighborhood. We have single issue coalitions like the picture that I just showed you. Folks are working on obesity or substance abuse or early childhood literacy. You have provider networks that are coming together that are asking, how can we work together as a network to get to scale in serving young people and do it with quality? You've got folks that are focused on early childhood versus older youth, college to career readiness on the other side, and then you have these overarching groups like the one you just created. Every community has all of these. The challenge is, how do you get them to work together? Here is a real picture. This is from a big city. This is from Atlanta. Here is a real picture of after 12 months of talking to all those different circles, they came up with their infrastructure. Then what happens is those boxes have coalition members, direct service providers, leaders in them. They are accountable for setting community level goals. Once those goals are set, they are now in an infrastructure, and the test of that infrastructure working is each one of those boxes, let's say the school readiness and early grade literacy box. They have to feel like they've got the right folks in that box, that they're confident that they can set and eventually achieve goals at the community level, and community for Atlanta is the metropolitan region. They have to believe that they can connect to the folks that they're connected to. When they need resources or they have things to say, they can go up. When they need to tap into expertise, they can go down. You'll notice that one of the things that happened was that a lot of those issue coalitions around adolescent risky behaviors all came together to make an adolescent services network. We could talk a lot more about that, but my red light is on. So I wanted to do a couple of things very quickly. One is to say it is extremely important, if you're really taking this idea of readiness seriously, that you back up, and I would argue have a conceptual map, a mental map of how you want to define readiness. I'm going to show you 3 quick pictures and I'm done. We talk about a readiness target. Academic and vocational, being academically and vocationally productive is critical. Managing risky behaviors, the outer ring, is critical to make sure young people are physically and emotionally healthy and safe. That middle ring of making sure that they're socially and civically connected is an important one, and it's one that we typically don't have data on. You're going to have a lot of data from your public health system or your juvenile justice system about kids being in trouble or pregnant, et cetera. You're going to have a lot of data from your school systems. You typically don't have data about social and emotional skills, civic engagement, overall sense of engagement and well-being, and you're going to need to find that. So one of the things that we've done for the past 3 years is develop a working partnership with Gallup. I'll tell you more about this when we sit, but I'm just going to give you 2 figures that tantalize everybody in the community, and no matter what your issue is, you'll believe that if you don't fix this, you're going to have a problem. Only 1 in 4 students in our schools, 5th through 12th grade, is hopeful, thriving, and engaged in school. Only 1 in 4. Second tantalizing picture, engagement drops steadily for every grade young people are in school. Every kindergartner comes to school engaged, ready to learn, and we beat it out of them for every year that they're in school. The only reason you see an uptick at the end is that they're allowed to drop out. So, a little depressing picture to get us thinking about this, but that kind of data, that should be malleable. We should really be able to fix that, and that's the kind of things that a broad community partnership can do. Also in the sense of making sure that all of the players in the community find their way. We know this is about education and increasing movement through the education pipeline. 9 young people graduating is not enough. Graduating from college out of 100 is not enough. But there's also important layers of insulation around the pipeline. And what we have found in our communities is that acknowledging that there are layers of insulation and that there are programs and organizations and initiatives focused on those layers has helped bring people to the table, keep them at the table, and it contributed to that organizational chart that I showed you. And then the last thing that I want to do, because it was interesting that as you talked about this initiative, I think both Lori and Tamara talked passionately about the lack of opportunities for young people out of school. Because this is the reality. We want to invest in young people from morning to night. We want to invest in them from little to big, however you want to define big. We want to make sure that they're operating across or building competencies across a range of outcome areas. School only fills a tiny bit of that developmental space, about 27%. So if you believe that young people get up in the morning looking for places to go, people to do, things to do, people to talk to, the school building, no matter how well it's run, is only a small amount of developmental space. And the question is, who fills the rest? We can stick a little box on called after school, but we still have a huge question of who fills the rest of that space. So when you're looking around your communities for partners, you need to find out who else is in the rest of that developmental space. Moving the needle means starting with the small gear and making sure that as collectively we're responsible for broadening our partnerships and creating that partnership infrastructure that Jeff shared with you so well, setting big goals and making sure those goals are balanced, using data well and getting the best data, and if that means going out and getting data in critical areas that we don't have, doing that, and then really taking bold actions that are going to be needle-moving actions, but recognizing that there's an interconnection between the interventions, and if we don't map them well, we may cut off something too soon. We can talk about the middle gear. I'm just going to point out the most important word for us in that middle gear is quality, and it's a word that I haven't heard today. We can increase access, but we have an amazing amount of research that says quality is what really moves that next gear. So we can get young people into programs, but if we set our sights too low, we're just doing babysitting. So with that, I'm going to let you go. Thank you.